All right. Hi, Jennifer. Welcome to Clearskin Laser. How are you?
Good, thanks.
Good. Well, today we are planning to treat you with a treatment called Photofacial. You've heard of that before?
Here?
Yes?
Yes.
Okay. So we will be doing your face, neck, and chest. That's our normal routine.
Okay.
And on your face, we're going to primarily be focusing on the underlying red that you have. Do you recall the red and the little telangiectasias and broken capillaries that we saw in the imaging device?
Yes, I do.
Okay, so what we're going to do is we will work on both the brown and the red, and that's what Photofacial does. It gets rid of browns and reds.
Okay.
And we will do your face, neck, and chest. We'll start with your face, then we'll go to the neck and the chest, and we may go back to the face, neck, and chest 2 or 3, 4 times, depending on what kind of temperature readings we get on your skin. Okay? So we're fairly aggressive. We go after it until your temperature doesn't allow us to continue.
Okay.
Okay? So if you recall, the treatment is about 3 weeks apart, and we can normally do quite a bit in 2 treatments. The protocol is 5 treatments, but we'll reevaluate after 2 treatments and see how you're doing. Okay? Now, you haven't been in the sun in the last 3 weeks, is that correct? And you have no plans to be in the sun in the near future, like
No.
3 weeks,
No.
correct? Okay, because sun is really the problem with this treatment, and I know you're good at that, but it is something we really pay attention to. So no sun. If you are out at all in Arizona, it's easy to be in the sun. You have to be covered up as much as possible, have sunblock on, all of that, okay?
Yes.
Okay. Do you have any questions?
No.
Well, you may want to know what it feels like.
Okay.
A rubber band stamp,
Oh,
okay? Many rubber band stamps.
okay.
But we cool you down. We use what's called a Zimmer cold air device, and it blows cold air, and we mist you with water, and we're continually checking your skin temperature. That's what really tells us how much we can do.
Okay.
And as long as we keep your temperature, your skin temperature in control, we can continue treating to get the most of the reds and the browns that we're trying to get. So it allows us to be a little more aggressive. But you are going to feel a rubber band snap. Usually by the 2nd or 3rd pass, it becomes somewhat numb from the cold air sensation. And people usually by that time are finding it to be much more comfortable. Okay? All right. If you have no other questions, we'll go ahead and get started.
Okay.
All right, you're here for Photofacial on your face, correct?
Yes.
All right. I'm going to hand you a headband and have you put that on just so that we can help keep your hair off of your face. Maybe. There you go. And then when you're ready, you can go ahead and lean back. Do you have any questions before we start? I know Larry did the consult and you feel pretty comfortable about all your questions being answered and such?
Yes.
Good.
I'm a little nervous.
That's okay.
I know.
Everyone is their first time. We're a little closer here. So I'm going to place gel on your face. Now you have not had any recent sun exposure, correct?
Correct.
Okay. We just had you clean your face, so that's all clean and ready to go.
Yes.
We're going to use eye pads. They're like little stickies.
Okay.
You place those on your eyes to help protect your eyes from the IPL device. Go ahead and close. Perfect. Grab some eyeglasses for myself. Okay, so Jennifer, I'll be starting on the right side of your face. I'm going to place some cold gel there. Starting by your ear. So during this treatment, if it starts to you start to feel like hot spots or anything that's heating up more than something else, let me know about that so we can take some time to cool it a little bit more.
Okay.
I'll be taking your temperature through the treatment to also keep an eye on that. It's also cold air that's going to be blowing on you the whole time to keep the treatment comfortable. So we'll be starting by your ear here. Here it goes. How's that feel?
Fine.
Little rubber band snaps. Not too
Pretty
bad.
comfortable.
Good. So I'm going to finish this pass up to your eye area, and then we'll take a moment to take your temperature, see how the skin's reacting and such. We're looking for microcrusting, which is the browns turning a darker color of brown, kind of like coffee grounds. I know mostly we're addressing reds on you. That was your main concern. So, any hot spots, anything feeling warmer than something else?
No?
No. Okay. Your temperature looks fine. So we'll proceed.
Okay.
Okay, Jennifer, you did really well.
Thanks.
I'm going to take the gel off at this point,
Okay.
and we're going to keep cooling you for a bit.
Okay.
I'm going to send you home with an ice pack. You're not going anywhere but home, correct?
Correct.
Okay. No movies or stops at the grocery store or the mall or anything like that. You've got to keep it cool
Okay.
for hours. Some people it can be anywhere from an hour, others it can be all the way to a few hours, 4 or 5 hours of cooling. So just keeping the skin nice and cool. You can use some frozen vegetables, ice cold water out of a spray bottle, anything like that.
Okay.
You don't want to go in the sun, obviously. And on the face, the microcrusting is going to start to flake off within 5 to 7 days. There's no rough texture to the skin or anything like that. So you can actually apply makeup if you were wanting to or needing to. And you're not going to feel anything. It's not going to be painful or uncomfortable, anything like that. Let's take off your eye shields here. Do you have questions about anything I've talked about or how to take care of it?
No, it seems great.
Okay, so the one thing you want to do is keep it well moisturized and of course wear sunscreen. Okay? All right.